At the beginning of each meeting, we have had a COVID update provided by Cobb Douglas Public Health. So bear with us as we queue that up virtually.
So I'm here today. I'm Dr. Janet Memark, District Health Director, and I'm here with Lisa Crossman, our Deputy Director, to give you an update on COVID at this time. So as we look at our cases, a lot of you know that we follow this case rate throughout the county. We are very happy that our cases have come down to 225 cases per 100,000. That is good because it's probably one of the lowest that we've reached in a while, but it is still of concern. So remember, it's still over 100 cases per 100,000, which is considered high spread. And I do believe that we had a lot of people that were out of town. And so I'm a little bit nervous that this is maybe a little bit falsely low at this point. So we're keeping a really good eye on this. All of the activities of spring break and over the last holiday, the Easter holiday, we should see that come out about in the next 2 weeks. And so a lot of people have been asking me, you know, what my thoughts are on our situation. And I do feel like the next couple of weeks will be very telling for us. And I'll show you a little bit more on why. One of the other numbers that we look at is the positivity rate on the test, and this is only the PCR tests that we're able to get these rates on. So currently the PCR tests are about 5.5%, and that is pretty good for what we're looking at for the positivity rate. Now, we do continue to see deaths that are coming into us. So when we look at yesterday, I gave a report that we were at about 999 deaths that were between the probable and confirmed deaths in our county. We surpassed that milestone yesterday, and we're at 1,008 confirmed and probable deaths. So this is something that we're definitely keeping an eye on. It has slowed down, but we're still continuing to lose our citizens to COVID-19, and so this is one of those things that we really are trying to put a stop to, hopefully. When you look at the regional hospital data, there has been a mild increase in the number of cases we've seen. Over the last couple of weeks, even in our regional districts, we have seen an increase in cases. Now, it's nothing like the surges that we had seen, but it's not where it was at the lowest possible numbers that we've seen. So it has come up a little bit, and we're keeping a very close eye on the hospitalizations throughout our district. So this is the last time you're going to see this map of the variants from the CDC. And those of you that have been keeping up with the news probably know why. It's because the B117 variant has become the dominant strain of COVID-19 that we're seeing in the United States. So you've been telling you that this has a doubling time of every 10 days and has been following that trajectory. In Georgia, last time I reported to you last week, it was only in the 500s that this variant was detected in Georgia. Now it's well over 1,000. And they are stopping individual case reporting of the variant. So they will just give us percentages of what they're seeing, but it is very quickly multiplying right beneath us. So we do have the other variants, the B1351 variant, the one that originated in South Africa, and then the P1 variant that originated in Brazil. So we have all of these variants in Georgia that continue to multiply and spread. So here's some of the transmission data we just talked about. We continue to be at more than high rates of transmission for the county at 225 cases per 100,000. And we still have a lower testing rate, but encourage folks to please continue to get tested. Remember, the variants are more easily transmittable and also thought to be possibly more deadly than the first strain of COVID-19 that we encountered. Here are some locations. We continue to get calls about testing. We have locations at the Jim Miller site through the Mako group that offers testing. And so there's a lot of other private groups that offer testing. We've had some of our other locations are going to convert to vaccination sites. And so the main site will be the Jim Miller site. Here's a snapshot of vaccinations throughout the state and throughout the county. And so you can see we're almost at 5 million vaccinations throughout Georgia, and about a 17% of fully vaccination rate. Cobb is very quickly catching up, and we're up to 16% of fully vaccinated rates, and that is going up. It seems to go up pretty quickly, so that's good news. We have about 300,000 vaccines that have been administered to our county. in our Jim Miller location, we've done, and in our outreach, we've done many vaccines as well. But at the district, we've done over 61,000 vaccines. So some of you, this is, hot off the press, the Johnson & Johnson vaccination. This morning, you may have heard that the FDA has called for a pause in the Johnson & Johnson vaccine. So we have been very busy this morning trying to, redo some operations that we're using the Johnson & Johnson vaccine. So this is concerns over very rare disorders involving blood clots. What I've read so far is that it's 6 cases that they're looking at when, and out of, I think it was over 3 million vaccines that have been administered. And so actually, yeah, those almost 7 million vaccines, I apologize, that have been administered. So there's, this is a very rare, but they're stopping to take a look at it. Tomorrow, the Advisory Committee on Immunization Practices will meet to take a look at this and what, if this is something that potentially is more of an issue than they thought. So I know people may be a little bit concerned about this, but I do want to reassure folks that one thing I'm very grateful for is that they are looking at the safety of this as we go along. And so when they've detected something that may be an issue, they will pause and take a look at all the data and take a better look at that. So this is very rare right now. And so we will just await to hear more guidance. This has been stopped, the Johnson & Johnson vaccine, throughout the state of Georgia. And so those of you that had appointments today, you may be shifted around a little bit. So I just want to make sure everybody knew about that ahead of time. So right now, it's for us, it's mostly outreach locations, but some of our partners were using Johnson & Johnson, and we're assisting them as well this morning. Okay, and I'll turn it over to Lisa Crossman.
Good morning, everyone. Thanks for having us again this morning. Just wanted to hit a couple of high points and reminders. So remember that in Georgia, the eligibility for vaccination is now open to everyone 16 years of age and older. Please remember that the Pfizer vaccine is the only approved vaccine that's available for children aged 16 and 17. So we do offer Pfizer at Jim Miller Park, also the GEMA sites like at Mercedes-Benz, and then most Walgreens and CVS retail pharmacies are also offering Pfizer. So before you might schedule your vaccine appointment for your 16 and 17-year-olds, I would just check to make sure that that site was offering Pfizer. Also remember that across the state, individuals that are under 18 need to have their parent or legal guardian present during vaccination to give consent. We've had a couple of folks that have sent their 16 or 17-year-old who can drive over to their appointment to get vaccinations, and we do want to remind folks that we need the parent there to give consent. Next slide. As Dr. Memark mentioned, we're going strong at Jim Miller Park. And we've administered, as of yesterday, over 46,000 to date in Cobb County. We've been working primarily to focus on getting those vaccines out to our Cobb residents, although remember that you do not have to get vaccinated in your home county. You can go to any county that is convenient to you. Fortunately, we've been seeing more vaccine coming into the state and into the county, and we've been able to open up more appointments in the last 2 weeks. So I think that we're at about 75% of our capacity right now, but we're excited that more of the vaccine is coming into us. Next slide. I also wanted to make sure that people had this slide, and we've put this out on our social media paths and everything. We want to make it as easy as possible for our residents to find a vaccine appointment. So first of all, you can go, as you see at the top of the slide, to our Cobb and Douglas Public Health.org. It connects you to all of these other sites as well, and you can get to all of the public health sites around the state of Georgia through that path. Also, myvaccinegeorgia.org that you see at the bottom left is the link to get to all the Georgia emergency management mass vaccination sites like at the Mercedes-Benz Stadium. And then on our dph.georgia.gov is a vaccine locator where you can put in your zip code and be able to find any of the other locations around the state that are near you, depending on how far you prefer to drive from your home zip code. And then lastly, on our site, we've put the vaccine finder. This is a link to all retail pharmacies. So if you're interested in going to a Walgreens or CVS or Kroger or Publix, you can link on that website to be able to find those locations. And they also will tell you which vaccine they're providing and if they have vaccine in stock. Next slide. We're so excited, and shout out to Cobb County government for launching the call center yesterday. I'll leave that to others if they're going to be giving an update, but really thank you so much for the support from the Board of Commissioners, from Kimberly and Communications, and from Cassie and her staff to be able to launch this. We think this is going to make such a difference in being able to answer questions for Cobb residents and to help them link to appointments and to answers for their questions. You can see the number on here. We also are pleased that we've been putting our new mobile van to work. We're doing 3 to 4 days a week now of outreach. We've partnered, if you'll go to the next slide, Dr. Memark, we've partnered with a number of groups to be able to get this out and be able to do mobile sites now that we feel that we've got our feet on the ground with our mass site at Jim Miller Park. So we have a partnership with Wellstar Health System where they're working with us with their congregational nurses. And we're going out, we began with senior centers last month, and we're now expanding out to some of our churches and shelters and other congregate living areas. And so that's going very well. We also, as you all know, we've been partnering with CORE, which is the Community Organized Relief Efforts Agency. We've been linking with them for the past 8 months to do COVID testing around the community. But last week and this week, we are converting all of those testing locations to vaccination sites. So we've already begun up at KSU BrandSmart on Tuesdays and Thursdays. We already began at Epicenter Word of Faith down in South Cobb on Wednesdays and Saturdays. And then last Friday was our first day at the St. Thomas the Apostle Catholic Church on Fridays. So we may move some of those around depending on need and offers to do some other satellites locations. But for right now, this is where we are, and we're offering vaccinations at that location too, at all of those locations as well. And then our Georgia Department of Public Health, sorry, Dr. Memark, our Georgia Department of Public Health is now offering on-site vaccinations for businesses with 500 plus employees. So we're working to support them. And then in the works as a great opportunity to reach our homebound residents next week. We're putting things together with one of our retail pharmacists and the Air National Guard to be able to go out and do some homebound residents. All right, next. We had a lot of fun with Cobb Senior Services a couple of weeks ago where we vaccinated the Peachtree Santas, Inc. Up at the North Cobb Senior Center. That was a lot of fun to get the Santas and the Mrs. Santas and their elves vaccinated. Next slide. So just key points kind of to end this up. One is to please continue to practice the prevention guidelines that we've been talking about for the past year. Wearing your mask, keeping your distance, washing your hands, being careful about being in large crowds. Please, we add to that, get vaccinated when you have access to vaccines. There are more and more vaccines coming into Georgia, so that appointments should be much more prevalent. So, for example, last week we released about 10,000 appointments for this week. Please, we would say take whichever brand, you know, Moderna, Pfizer, please kind of pause on the J&J for right now until we know more about that. But all of them have excellent effectiveness. And then just thank you again for launching the call center. Thank you so much.
Thank you, Lisa. And again, Dr. Memark, for being with us today and providing this helpful update. Also want to thank you too, in addition to our team at IS and our emergency response division for helping to put together the call center. And we hope that we're able to reach a population that has had difficulty getting scheduled online. With that, are there any questions from commissioners this morning? We don't have any questions, but again, we thank you and appreciate the caution that you're asking us to still take, even though we see the rate going down. We're still not below that 100 over 100,000 threshold. So we know that we still need to be doing what we can to wear our mask, wash our hands, and watch our distance. So.